Good afternoon. Stomach cancer, also known as gastric cancer, is a buildup of abnormal cells that form a mass in a part of the stomach. This is rapidly increasing, as is colon and rectal cancer. According to the World Health Organization, 7,23,000 cancer-related deaths are caused by the stomach cancer each year worldwide. It is the fifth most common cancer worldwide, but the third leading cause of cancer-related deaths. To know more on GI cancer, colon and stomach cancer, and its treatment options, we have with us Dr. Ajit Bai, consultant surgical oncologist and robotic surgeon at Apollo Cancer Center, Chennai.
Good afternoon.
Good afternoon, doctor. How is stomach cancer detected?
So stomach cancer can mean two things. It could be gastric cancer, which is the stomach as such, or a lot of people take the stomach to mean the entire gastrointestinal tract, which could be the food pipe, the stomach, the pancreas, the colon, or the rectum. So if you take just the stomach cancer, commonly it produces symptoms like dyspepsia or indigestion. So what happens is a person usually in their 50s who comes with a vague feeling of being unwell, has upper abdominal pain, has some indigestion, maybe some black colored material in the stool, which is blood trickling down and getting altered, should definitely have a blood test to look at the hemoglobin and the liver function, apart from an endoscopy to look at the food pipe and stomach. And then if there are ulcers or growth, they can be biopsied, following which an ultrasound or a CT scan can be done to know the extent of cancer, and then they can meet a specialist.
And what are the typical symptoms, doctor?
The typical symptoms of stomach cancer are loss of weight, loss of appetite, early satiety, which means that you take a small amount of food. Let's say you're eating 4 idlis, you're only able to take 2 idlis, and this is continues to deteriorate to the point that you can only take very small quantities of food. Fatigue or weakness, which when you do a blood test will come as anemia, indicating slow loss of blood from the tumor. And also sometimes symptoms related to spread, such as bloating in the belly due to fluid accumulation or a jaundice due to spread to the liver, can all be presenting symptoms of a stomach or gastric cancer.
And what are the types of GI cancer?
So the GI is a long segment organ which starts at the mouth and ends at the anus. So you have the food pipe or esophagus, you have the stomach where the food digestion starts, you have the small intestine or small bowel, you have the large intestine or colon where water is absorbed, and you have the rectum, which is the last 6 inches of the gastrointestinal tract where the food, fecal matter is stored before removed. Then you also have the liver, gallbladder, and pancreas, which help in digestion of the food which is before absorption.
How long can stomach cancer go undetected?
A lot of patients with stomach cancer present very late. The reason is that the symptoms are quite non-specific, which means that it is just a little bit of loss of weight, a little bit of indigestion, a little bit of feeling unwell. So actual symptoms such as vomiting or not able to pass stool or severe pain usually come in very advanced stages, which is why a lot of patients come late to the doctor because they don't really have symptoms which require very serious attention.
And why does stomach cancer affect men more than women? Or is it just a myth?
So stomach cancer is a lifestyle disease. So we know that smoking can cause up to 10% of stomach cancers by use of tobacco. Also alcohol, eating a lot of pickled and salted food, eating barbecued food. All these probably are more common in people who drink. And since men drink more commonly than women, it may be an association of the fact that the primary agent is alcohol, which causes cancer.
And why is colon cancer a burning issue today? Could you throw some more light on colon cancer and who's susceptible to it? And
so colon is about a 1.5 meter organ, which basically absorbs water from the undigested material and makes it stool. The reason why colon cancer is overall common in the gastrointestinal tract is because of long contact time. So, once you eat, it's almost 12 hours before the undigested material reaches the end of the GI tract, out of which about 6 hours is spent in the colon alone, 6 to 8 hours. So because of long contact time, all the unhealthy material in the digested food is in contact with the colon for a much longer time, which is why overall colon cancers are commoner. Now, colon cancer is one of the leading cancers in the world, as high as 3 times the third most common cancer in men and the second most common cancer in women after breast cancer. In India, it is also rapidly increasing because it is due to westernization of our lifestyle. Westernization means eating a high-fat diet, eating a lot of processed food, eating a lot of red meat and processed meat like bacon and ham, for example, or the lamb meat what you eat in a burger. These are all processed meats which are even more unhealthy than the normal meats. Apart from that, obesity, is a burning issue. As much as 30% of population, even a city like Chennai, are obese or overweight. So obesity increases the fat in the body, and this is also related to certain abnormal changes in the colon mucosa, which leads to cancer. Alcohol is another risk factor for colon cancer, though not as strong as for other cancers such as liver and stomach. So overall, the westernization of our diet, adoption of unhealthy lifestyle practices, sedentary lifestyle, all have rapidly increased the incidence of colon cancer.
I have been on and off having nausea for the last couple of weeks. I'm so terrified of stomach cancer. So, what are the symptoms of stomach cancer? As doctor had already explained it to you, viewer, and I'm. It gets worse. What should I do?
So definitely if the nausea is persisting without any cause, that is, you can have nausea related to, say, eating somewhere outside, you had food poisoning, you can have nausea for a few days. Or sometimes if you're on a lot of medication for, say, a cold or a flu, you can have nausea related to the medications, or if you're on antibiotic. But if you're not on medication, the nausea is persisting for more than 3 to 4 weeks, definitely it's abnormal. It could be something as simple as a stomach bug. So we have a bacterial infection which is called Helicobacter pylori infection, which is a major cause of acidity and ulcers in the stomach. So it's basically a bacterial damage to the stomach lining which causes Helicobacter pylori infection. This can cause reflux, acidity, nausea, loss of appetite, etc. Rarely it can also cause a particular type of stomach cancer called lymphoma. So if you have persistent symptoms, even nausea, then you need to see a doctor who will take a detailed history, rule out some simple causes like medications you're taking which can cause nausea, and then probably he'll direct you for an endoscopy if required, or put you on medication, review after a few weeks, and then do an endoscopy if required. Most important, see your doctor if any symptom persists beyond 3 to 4 weeks.
My father, age 69, is suffering from stomach cancer. Feeding pipe is placed under the stomach, and now he is taking 100 to 150 ml of liquid food only. Kindly suggest if it's sufficient for his nutrition and vitamins.
So the only way to know whether it's sufficient is, of course, to weigh him every week. So if his weight is increasing every week and he's putting on muscle, then obviously the nutrition is working. It's important to have a consult with a nutritionist or a dietitian. They would check his weight, check what disease he has, check whether he's got diabetes or kidney problems, and advise appropriate, dietary products which are available in the market in terms of how much carbohydrate, how much protein, and how much fat they contain. As also explain about what monitoring is required for a patient who's totally being fed by a tube, and in consultation with the surgeon, decide about the way forward.
And which is the most common gastrointestinal cancer, doctor?
The most common in India is still colon and rectal cancer. As I explained earlier, because the colon is exposed to the undigested material for a longer period of time, it is the organ most susceptible, apart from the fact that it's a very long organ. So the colon from the beginning, where the appendix is, to the end is almost 1.5 to 2 meters long. So that's 200 centimeters of intestine, apart from the fact that it has a large surface area because it's a wide organ. So because of all these reasons, it is the commonest cancer in the GI tract. Though in Chennai, in the registry in Chennai, stomach cancer is number one cancer in males, um, because we have a lot of patients coming to Chennai from Andhra. And the risk factor here is spicy food and alcohol and pickled food, all of which are very strong risk factors for stomach cancer.
And is food the only reason for stomach or colon or rectal cancer?
Yes, food obviously is an important thing because it is the portal for entry of most of the carcinogens into the body. So when we say food, what do we mean? We mean anything coming in a can or a bag, which is processed food containing preservatives, to some extent cannot be good for you. Processed meats like bacon or ham, pickled foods, that is regular pickles, salted fish, pickled food, this is very common, especially in the northeast part of our country and East Asia, which is why Koreans, Japanese, and Northeast patients from Assam and say Mizoram have very high incidence of food pipe and stomach cancer. The salted meats and all, they produce chemicals called nitrosamines, which are highly damaging to the food pipe and stomach and are known to be a class 1 carcinogen, which means that they are definitely carcinogens. There is no doubt about it. And other lifestyle things are tobacco and alcohol. Tobacco use in any form is inimical, we know that. but especially for stomach, it's bad. And alcohol is bad for stomach, pancreas, and the colon. Any amount of alcohol is unsafe. There is no safe limit for drinking alcohol. Even a drink a day increases the risk above a normal person who does not drink.
And is gastrointestinal cancer completely curable?
Um, Cure, when we take, so we say cure, we're looking at least a 5 year survival, which means from the time of diagnosis and treatment that the person is alive for 5 years and beyond. So in GI cancers, it depends on two things. One is how early they come. Second is which site is involved. For example, we know that colon and rectal cancers, by and large, in early stage, are curable. We are looking at 5 year survival as high as 70 to 80%, which means of 100 people coming to you, 80 of them will survive beyond 5 years. Some of them may have cancers coming back after that, but the chance is very low after the first 1.5 years. If you take food pipe cancers, esophageal, or pancreatic cancers, they're extremely bad cancers. 75 to 80% of these cancers are incurable from the word go because they have already spread beyond the confines of cure. Same way with stomach cancer, because it spreads rapidly to the liver or the nodes. Only about three-fourths of patients, only about one quarter of patients are suitable for any form of therapy. So if you have stomach or pancreatic or food pipe cancers, obviously you are straight away a little at a disadvantage compared to somebody who has, let's say, a large intestine or rectal cancer. But that said, if you come early to your doctor, as soon as your symptoms are something which are out of the ordinary, then there's a high chance that even with these cancers with modern therapy, you can be cured.
Does hyperacidity lead to colon or stomach cancer?
Hyperacidity can lead to food pipe cancers. Like I said, Helicobacter pylori is an infection which is quite common, which affects the stomach. It increases acidity, and because it increases acidity, it can also cause acid to enter the food pipe. Acid in the food pipe is very damaging. It causes a change called Barrett's esophagus, where the lining of the food pipe becomes just like the lining of the stomach. Now, to repeated episodes of damage by the acid and healing, when it happens, some changes, abnormal changes occur, and people with Barrett's who have a precancerous stage called dysplasia, high-grade dysplasia, have a 125-fold higher incidence of food pipe cancer compared to normal population. So definitely, and second thing is most people who get a reflux or acidity are obese. So it could be that the obesity is also a risk factor apart from the acidity causing either food pipe or stomach cancers.
What is pancreatic cancer, doctor, and what are the symptoms for pancreatic cancer?
So the pancreas is a fleshy organ located deep in the belly. It's behind the stomach and it's important for digestion of proteins and fats and also of carbohydrates. So we know the common disease we get of pancreatic disease is diabetes, which is because of loss of function of production of insulin, which is a hormone necessary to regulate glucose. This is called the endocrine function. You also have an exocrine function, which is the digestive enzymes necessary for digestion. So if you don't have a pancreas, apart from being diabetic, you will also have indigestion. So pancreatic cancer is a very bad cancer because it produces symptoms very late. So by the time they come to you, like I said earlier, almost 75 to 80% of people have advanced disease, which has either spread to the nodes or spread to the liver. And the common presentation, apart from pain, is with jaundice. Jaundice occurs because the bile duct which drains bile from the liver is blocked by the pancreatic cancer because the bile duct has to drain through the pancreas. So pancreatic cancer presents quite late. If it presents early, then the treatment of choice is surgery, what is called the Whipple operation, followed by chemo. If very advanced, then the only treatment possible is either chemotherapy with radiation or chemotherapy alone. The 5 year survival for pancreatic cancer unselected is as low as 15 to 20%. And if it is spread to the liver, then there are no 5 year survivals. Unfortunately, the symptoms are quite vague, which is why most people come to you when the disease is advanced.
And who is at a major risk for pancreatic cancer?
So pancreatic cancer again is a lifestyle disease. So smoking causes 25% of pancreatic cancer straight away. Of the remaining three-fourths, it is alcohol, it is obesity. For some reason, people who are very tall are at the increased risk of pancreatic cancer, as also is processed food and red meats and processed red meat. The strongest association is with obesity, alcohol, and smoking. So to large extent can be prevented if these are taken care of.
What are the most common myths related to colon and stomach cancers, doctor, today?
So the common myths which are common to, I would say, most cancers is one that it's completely incurable. Once you get a cancer, it can't be cured. Like I said, many of the cancers, when they present early, and if you're diagnosed early, high chance of cure, as high as 70 to 80% 5 year survival. Second is that it's contagious, that if you have cancer, it's going to be transmitted to somebody. It's not an infection. So you can't transmit cancer to somebody except if it's like a viral infection which can cause cancer. Like hepatitis B can be transmitted by needle sharing or by blood products, can cause liver cancer. But apart from those rare situations, it is not contagious. And the other thing is that all these cancers will spread from you to your child. That is, they're always hereditary. Or you feel that I have got cancer, my father and mother didn't have, why have I got it? So only 5% of cancers are hereditary, which means that the father or mother has a gene which can be transmitted to the offspring, or a grandfather had a gene which is transmitted. Apart from that, the remaining 90 to 95%, though there is a genetic alteration, it is sporadic, which means you get the cancer, it doesn't transmit to your offspring. So these are the common myths about gastrointestinal cancers.
Hello, doctor. I'm 63-year-old male from Chennai. What are the complications associated with the treatment of GI cancer?
So the complications again will depend on what site is affected. If you go for surgery, then the common or feared complication is leakage. So when you remove a part of an organ, for example, part of the stomach, part of the colon or small intestine, you have to join it back to the rest of the thing to have a functional passage, which means that you eat food and you're able to pass it from below. So any of these joints, especially in a weakened state, can leak. And if it leaks, it can be quite damaging because you can't eat food and you have stool or bile leaking out through an abdominal wound. That is the feared complication. Apart from that, complications related to the wound, for example, wound infection or give way of the wound, or complications related to chemotherapy. Because the problem with GI cancers is when you're on chemotherapy, it's also affecting your small intestine, your stomach, you get ulcers, you're vomiting, not able to maintain nutrition. So you're already weakened, you're taking chemotherapy, which is the right treatment, but that can weaken you further. So that is one thing. However, surgery, which is a cornerstone of treatment for most GI cancers, can now be performed much better by minimal invasive method, which is what we know as keyhole surgery, either laparoscopy or robotic, which means that the smaller the incision, the faster the recovery for the same operation, less chance of wound infection or complication because the incisions are very tiny. This is something I think which is a recent advance which has really helped many patients get back to normal activity. One. Second is also start your chemotherapy very early because you have less complications. So I think in both ways it's a boon that we have the keyhole surgery, which is lap or robotic, available at many places in the country and around the world.
Apart from the keyhole surgery, are there any new advancements in the treatment of GI cancer today?
I think more and more we are moving to a state where we are giving chemo or chemo and radiation before surgery to shrink the tumor rather than going directly for surgery. So what happens is if we take foot pipe and rectal cancer, we take it as two paradigms. Almost all patients, I would say 80 to 90% of patients have disease which has come out of the organ. So for that, what we do is we give a combination of radiation with a small dose of chemo, shrink the tumor really down. In some cases, the tumor can completely disappear. And then we do a good quality surgery by minimal access, which is lap or robotic. And we are able to take out the organ, which has shrunk with the terms of the cancer being confined just to the lining of the intestine rather than coming out. People who have a complete response, which means that the cancer has completely disappeared when you take it out after the radiation, usually become long-term survivors. So this is one thing. Second is, like I said, laparoscopy and robotic, which means the same surgery can be performed as radically as with open surgery with much, much quicker recovery and return of normal function, return to normal life or work. Third is even for certain advanced cancers which spread to the lining, what is called the peritoneum, especially typically the paradigm is colon cancers, can often spread just to the lining and remain there in the lining without spreading anywhere for a long period of time. Typically, such people unfortunately never used to survive more than 1.5 to 2 years. Now we are able to use chemotherapy during surgery, pouring heated chemo into the belly, what is called the HIPEC, HIPEC, or heated intraperitoneal chemotherapy surgery, which has a high rate of cure such that patients who would normally not be alive at 18 months are now surviving more than 5 years. As high as 50% of patients with this therapy can survive up to 5 years. So this is another advance which is very useful because many patients come with advanced cancers. Normally we just send them home. We are able to definitely treat and cure at least 50% of them from a point where none of them are surviving beyond 18 months. So these are some of the new advances we offer in gastrointestinal cancer treatment.
My husband has been suffering from digestion issues leading to constipation and bloating. He is on and off medication, giving him temporary relief at the moment. What is the best course of treatment to follow? Kindly advise.
I think he needs to see a doctor because the symptoms are quite non-specific. So it could be nothing, or it could be something serious. So I think if the problems are persisting, then he definitely needs to see a physician first, who will evaluate him thoroughly, check him clinically, check his belly, maybe advise some simple tests like an ultrasound and blood test. And then if something is found in that, then he can come and see a specialist like me, and we can take it from there.
We've had questions relating to small bowel cancer. Could you share some insights on that?
Okay, so fortunately, the small bowel is a very rare site of cancer. So the small bowel is a part of the intestine which connects the stomach to the large intestine. Now, the small bowel in an average adult is about 350 centimeters, or about 3.5 meters in length. So it's a long organ. So we would expect a long organ to have more incidence of cancer purely because it's so long. But because the food is in a liquid state and rapidly passes through the small intestine into the large intestine, it is only there in the small intestine at the most for maybe a couple of hours or less. So the contact of this food material, which is partly digested, is very short with the small intestine. Because of this, small intestinal cancers are quite rare. That said, we have two types of cancers. One is the lymphomas, which is basically a tumor of the lymph nodes which can occur any in the body. And the small intestine, because it also contains lymphatic tissue, can give rise to lymphoma. Second is adenocarcinoma, which is a typical cancer we see in the colon, rectum, esophagus, or stomach. This is very, very rare to the point that most people, even in centers like ours, which are high volume centers, maybe see 2 or 3 patients a year with small intestinal cancer. So the treatment is the same. It is surgery to remove the affected organ, join it back, followed by chemotherapy. Because it's such a rare cancer, the causative factors are not known, and we don't have much of data about the long-term outcomes. But fortunately, like I said, it's very rare.
Can GI cancer spread to other parts of the body?
They can. So one hallmark of cancer is the ability to metastasize, which is the ability to spread from where it has arisen through the blood or the lymphatic tissues, or by direct spread to another organ. So typically we see the organ they spread to, apart from the nodes around each organ, is the liver. The liver is a very rich blood supply. All the blood from the intestine and stomach goes through the liver. So the liver filters out these cancer cells, tries to trap them, but also gets involved, like how when you put seed in a fertile soil, what we call the seed and soil hypothesis. When you put it in a fertile environment like the liver, you're definitely going to have more chance of getting mets. So liver, lymph nodes, and the third organ commonly affected is the peritoneum, which is like a skin or lining on the inside of the belly. This can commonly get affected by multiple nodules, what is called peritoneal carcinomatosis, which typically presents with fluid in the belly, which is a common presenting feature for patients with GI cancers.
How dangerous can pancreatic cancer be?
So, as I mentioned, pancreas, because it is deeply located in the body and because it doesn't cause any symptoms till very late, it can be a very, very deadly cancer. So, it's the seventh most common cancer in the world across the board. But if you look at death rate from this cancer, it is the third most fatal cancer, second to third most fatal cancer. Why? Because most pancreatic cancers come either with spread to the liver or they're stuck to the major blood vessels. It's not possible to offer them surgery, which is the main treatment. Again, with pancreas, you can have the classical pancreatic cancers, which are called adenocarcinomas, or you can have something very rare, what is called neuroendocrine cancers. This is a peculiar cancer which affects any part of the gastrointestinal tract. It remains confined to the organ for long periods of time, but eventually it can spread to the liver and can produce abnormal substances which can damage the heart and other organs. So because the pancreas presents late, the cure rates are quite low, except if you're able to offer surgery for an early pancreatic cancer, which is picked up, let's say for some other thing, person went for tests, then you can have a 5-year survival as high as 40 to 50%.
Thank you, doctor. I am male, 38 years old. I was having pain in the abdomen. I did some tests like endoscopy, colonoscopy, ECG, echo, USG, MRI, and biopsy. I'm waiting for the biopsy results yet. On the initial tests done, it has been found that there's a mass lesion, approximately 6 to 7 centimeters, and the pathology results have indicated some medical terms such as malignancy, spindle cell sarcoma. But the doctor wants to confirm everything once the biopsy results come. Please suggest what are the terms like malignancy and spindle cell sarcoma? Am I in some danger? What are the precautions that I should take? Please guide me.
So malignancy is a generic term for cancer. So you have benign and you have malignant. So malignant is, like I said, something which can locally damage the organ and can spread to another organ such as the liver. So if you have malignancy, you have cancer. Now, cancer is a tumor which arises from the lining of a tract, like oral cancer, food pipe cancer. The same cancer, if it comes in the tissues around the lining, that is the wall of the stomach, for example, which has muscle, that would be something what we call a spindle cell neoplasm or a sarcoma or what we call GIST, gastrointestinal stromal tumors. So the broad term of cancer means all malignancies, but then actually all malignancies are not cancer in the sense that cancer is a specific term to mention only cancers which arise from the lining of these organs. So anything which comes outside the lining, for example, in the wall of the stomach, is actually what is called a sarcoma, which is what you might be having. So once your tests are ready, you need to see a specialist like me, where we can look at the stage of the cancer, that is how much it has spread within the organ and outside the organ, what is the biopsy, maybe order some additional tests on the same biopsy material which has been taken out, and then decide about surgery versus some form of treatment and surgery, or only chemotherapy or tablet treatment.
My father has had a gallbladder surgery in June this year. He's 72 years. He has BP and diabetes. He's on medication for the same and Ecosprin tablets. He has lost his appetite and is not as before. Is there anything to be concerned about, or is it normal for his age?
No, I think definitely after removal of the gallbladder, you can have something called a post-cholecystectomy syndrome. That is, the gallbladder is removed, you can have some indigestion, some vague pains, all this can occur. But again, if it is not that at 72 you have to be unwell. So it is not acceptable at any age to be unwell. So I think any symptoms after a recent surgery, definitely you should see your doctor who treated you. He may advise simple blood tests, maybe an ultrasound. Sometimes gallstones can exist with things like hiatus hernia, which is basically the stomach is able to slide into the chest. That can cause reflux and acidity. So they all come as part of a syndrome where you have this reflux, you have gallstones. So the gallstones might have been incidental, which means that they were not the cause of the indigestion or pain. It is just that they had stones, so it was removed. So you may need an endoscopy or a fresh consult with a gastroenterologist.
I am male, 46 from Madurai. My age is my wife's age is 62. I She had a Whipple surgery. I had a Whipple surgery. Sorry, I had a Whipple surgery for duodenal carcinoma, first stage. Till now, everything is okay. But the last 4 5 days, I feel stomach pain and some air from the chest to down. I feel uncomfortable sometimes and can't stand or sit down, and I'm not feeling okay. The whole day, around 3 to 4 times, I have such pain. Is it serious?
Depends on how long ago your surgery was. So I think in the first about 2 or 3 months after surgery, you may have some aches and pains and some abnormalities before the intestine and all the tissue settle down and your wound heals. But after the first about, I would say, 8 to 12 weeks, if you have abnormal pain, then definitely you need to see a doctor. It could be a problem related to your prior surgery, or it could be something like intestine sticking to each other, what you call adhesions, which can occur after any major surgery. These adhesions can cause the bowel to kink or twist, and they can cause pain. So simple tests like taking an X-ray or making you swallow a small amount of a material like a contrast and taking a scan may delineate and solve the problem also. So anything persisting beyond 8 to 12 weeks after surgery is abnormal. Even pain is abnormal, and you should see your the doctor who did the Whipple and take it forward from there.
Hello, doctor. My dad is diagnosed with stage 4 stomach cancer. The cancer has spread to his liver and pancreas. He has completed his first chemotherapy 3 days back. Till this day, he did not have any nausea, but today he suddenly had vomiting, which is dark black in color. Could you please suggest what needs to be done now and what exactly is his condition? I am, anyways, going to the doctor this evening, but wanted to check on your expert advice.
So I think he's on treatment with chemotherapy, which is the right treatment for somebody where the cancer has spread to the liver or the pancreas. Now, the tumors can bleed on treatment or before treatment. So since he's on chemotherapy, the tumor may be starting to shrink. So as the tumor shrinks, what happens is part of the tissue dies off and it comes off, exposing some blood vessels inside, and this can cause bleeding. The blood, when it mixes with the acid, produces a black color, which is what he has brought out as a very irritant material. That's why he's vomited it out. The body is trying to clear it. So definitely, I think you need to see your medical oncologist, the person who's giving you the chemotherapy. He may want to check the blood pressure, the pulse, make sure that he has adequate fluids in his body. He may want to also advise some medications to stop the bleeding and reduce the nausea and the vomiting. If it persists and the bleeding is quite a lot, then you may need to see a gastroenterologist, again through your oncologist, who may just put a scope in and arrest the bleeding by injecting certain materials which can stop the bleeding or actually kind of burning the surface so that the bleeding stops. In any case, I think bleeding while on treatment is a serious symptom, and you should see your medical oncologist and maybe a gastroenterologist eventually.
What is your word of advice for our viewers today, Doctor?
So, word of advice as related to GI cancers is, though it is pretty common and prevalent and increasing, there is no need to get worried. What we can do is that if all of us make a lifestyle shift over the next 20 to 30 years, the incidence can come down. Just like tobacco use reduction can reduce the risk of oral cancers, use of pap smears and vaccines can reduce the risk of cervical cancer, screening can reduce breast cancer. The GI cancers are a paradigm because they are common and most of it is lifestyle related. So I think the important thing is stop smoking, cut down or reduce alcohol intake because any amount of alcohol is harmful. Reduce processed food intake, especially red meat, which means beef, lamb, and pork, and processed red meats, which is like bacon or ham, are extremely dangerous. Eating bacon, for example, every day in the Western population is a significant risk factor which doubles or triples the risk of colon rectal cancer compared to somebody who doesn't eat bacon. Other thing is to maintain an ideal body weight for your height and for your age and height. So the lower the body weight, the less the chance of you developing colon cancers, rectal cancers, pancreatic cancers, and even stomach cancers. Avoid pickled food and stored food, especially storing food in the fridge and reheating. Especially reheating meat is very bad. So what happens when you reheat meat is it produces certain chemicals called nitrosamines, which is the same thing which happens when you barbecue food. So charred or barbecued food like tikkas, kebabs are extremely dangerous when had on a regular basis because they are reheated, they are smoked at high temperatures. This produces chemicals called nitrosamines, which are extremely damaging to the food pipe and stomach, which is why alcohol is a risk factor because with alcohol, if you take these food, then the risk is more than 1+1. It increases exponentially. So maintaining your ideal body weight, avoiding all these processed meats and foods, and definitely stopping smoking and drinking in moderation if you drink at all the things which are going to reduce the risk of this cancer over a period of 20 to 30 years in the entire population. Apart from that, I think come early to the doctor. Don't wait and then, when the symptom becomes really terrible, come to the doctor. If you're not feeling well for 4 to 6 weeks, you're having some nausea, some indigestion feeling, or you have black color in your stool or bleeding in the stool, which is a common thing mistaken for piles. Most bleeding in the stool people assume is piles. Though piles are the common source of bleeding, rarely if you're able over the age of 40 or 50, you can have a colon cancer which is also producing the bleeding. It is just that piles are so common that we mistake it as due to piles. So if you are having piles or bleeding in the stool, definitely consult your doctor and a specialist. Maybe take a second opinion before deciding it is piles. Don't be your own doctor. And with all these things, I think you can prevent GI cancers, detect it early. Another word of caution is that if you have something like colon cancer in your family, first degree relative, which means your father, brother or sister or child had colon cancer, more commonly of your parents or your sibling, you are at high risk. So start screening yourself by simple tests like checking the stool for blood, what is called a stool occult blood test, or a colonoscopy, which can be done once in 5 to 10 years, starting 10 years before the youngest person in your family who had cancer. So let's say your father had cancer at the age of 50, colon cancer. You should start screening at the age of 40. So this is very important. If you have a family history of cancer, you definitely need to find out what are the constellation of cancers apart from colon. For example, colon, breast, ovary, and uterine cancers go as a group. So if somebody has colon cancer, then the lady in the family may get uterine or ovarian cancer. So the family as such has to be on alert, not to become very, very upset about this, but definitely see the doctor and get counseling about what is required to prevent the cancers from coming. Or if they come so early that it's almost as if you never had the cancer after the treatment.
Thank you very much for a wonderful, informative session, Doctor. For appointments with Dr. Ajit Pai, please get in touch with 044 611 51294. I repeat, 611 51294. Thank you, Doctor.
Thank you.
Thank you, viewers.